Now to a conversation that is happening around dinner tables nationwide tonight. You're talking about it. Whether you're a parent, you're a grandparent, you're a teacher, you're a school administrator, or you are a student trying to learn. The pandemic continues to have an undeniable impact on our kids' education. And new tonight, the CDC and the White House are weighing in on a roadmap on how to safely reopen public schools and get our kids back in the classroom. NewsNation national political correspondent Dean Reynolds joins us live tonight to explain. Dean.
Marnie, by offering a pathway to reopen the nation's schools amid the pandemic, the CDC is trying to bridge concerns for teachers, for their students, and for parents worried that their children may be falling behind. You hear it from parents all over the country.
You can go to a grocery store and there's 1 million people inside the grocery store. Why can't these kids be in school and learn in school? You'll take your kids to the store with you, so let the kids go to school.
They miss their friends terribly. They're not getting nearly enough exercise. Trying to not have them spend as much screen time as they have is a real challenge.
Today, with millions already vaccinated, but hundreds of millions more in need of a shot, the CDC offered guidance on how to reopen the schoolhouse doors. Dr. Rochelle Walensky has been director of the CDC for less than a month, and today she held a conference call with reporters.
CDC recommends that schools can provide full in-person instruction with universal use of masks and other mitigation strategies. However, as levels of community transmission rise into high levels, as is currently the case in over 90% of our counties, schools should require physical distancing of at least 6 feet and reduce sports and other extracurricular activities.
Those other mitigation strategies she recommended are familiar: social distancing, hand washing, covering sneezes and coughs, cleaning and maintaining schools from top to bottom, plus rapid contact tracing, isolation of those infected, and regular testing of staff and students. President Biden conceded that some schools will need more teachers and support staff to meet the guidelines, more school buses and drivers, and more protective equipment. These needs cost money, he said in a statement today, but the cost of keeping our children, family, and educators safe is nothing when compared with the cost of inaction.
CDC is not mandating that schools reopen. These recommendations simply provide schools a long-needed roadmap for how to do so safely under different levels of disease in the community.
She pointed to 2 scientific data points in particular.
Less than 10% of COVID-19 cases in the U.S. have been among children and adolescents between the ages of 5 and 17. Evidence suggests that staff-to-staff transmission is more common than transmission from student to staff, staff to student, or student to student.
And yet educators and their unions tend to oppose the idea of open in-person schooling until teachers are vaccinated.
We believe that prioritizing school staff for the vaccine is really the best and most efficient way to ensure that everyone can return safely to their schools and be back in the classrooms in person now and be ready to go for the new school year.
And the CDC doesn't disagree. Teachers, it said, should be vaccinated as soon as possible. But vaccinations are not a condition for teachers returning to the classroom.